Close your eyes and picture an elderly woman in her 80s with perfectly permed white cotton hair, tiny frame, frail, with beautiful wrinkles on her face. And let's name her Dorothy. Dorothy is one of my residents at the retirement community where I work. She's 83 years old and she's battling opioid addiction as we speak. She came to our community looking for help. She was in a car accident a little over 5 years ago. Her back was badly hurt. She was prescribed Vicodin, a combination of hydrocodone and acetaminophen, a narcotic used to treat pain, Flexeril, a muscle relaxant, and Xanax to help with the anxiety brought on by her accident. Every one of these pills are highly addictive substances. She has been on these pills for years. The last 2 years, her addiction has gotten worse. She admits to visiting several doctors to get medications, and when she runs out, she takes a trip to the ER to get more pills. She's even stooped to asking her husband to complain of pain to supply her with more narcotics. Dorothy knows she needs help and that she cannot do this alone. That's why she came to us to help her with medication management, but it has not been easy for her. She has visited therapists, church counselors, and other professionals, but she continues to struggle every day. Unfortunately, Dorothy is not an isolated incident. There are millions of seniors going through this battle with little to no help. Nearly 1 million adults aged 65 and older live with substance use disorder. This could be your family, your parents, your grandparents, and it could be easily prevented. Today, we're going to learn why it is imperative that Congress take action to address the opioid crisis among senior citizens. We're going to discuss the problem, the main causes, and the solution. We have a serious problem. Seniors are increasingly becoming addicted to prescribed narcotics. According to aginginplace.com, a resource that helps seniors navigate through the challenges of aging, 35% of people 65 and older experience chronic pain. 1 in 3 misuse narcotics to ease their symptoms. The number of seniors with prescribed narcotics has increased 9 times between 1996 and 2010. This is according to Psychiatric Times. With this increased use of opioids among elderly, hospitalization rates for geriatric misuse of narcotics has quadrupled in the last 20 years. Opioids mentally, physically, and emotionally affect senior patients. Physicians are prescribing narcotics like they're mints. Louise Arison, a geriatric author and professor of medicine at UC San Francisco, discovered that medical school curriculum, even at top universities, still emphasizes the same core rotations with their medical students. If geriatrics was mentioned at all, it was an elective course. This is unacceptable, especially for the fast-growing senior population. According to the American Geriatric Society, doctors are in short supply, with only half of the 6,900 board-certified geriatricians practicing. This leaves a huge gap in specialized care for the elderly. Because of the lack of geriatric physicians and the little focus towards geriatric training, seniors are left as the healthcare's forgotten community. As a result of lack of training, 15% of seniors discharged from hospitals have left with an opioid prescription, such as hydrocodone, codeine, and oxycodone. This is a major problem, especially because they're not adequately informed about the effects of narcotics and what it could cause to their already weakened and frail systems. We know that this is a huge problem, but have you thought of the devastating causes affecting our elderly? There are 3 significant causes: improper assessment by physicians, absence in education about opioid effects, and lack of follow-up by physicians. Again, physicians are not properly being taught how to assess geriatric patients. This results in errors in prescription and dosing. Senior adults do not metabolize medications at the same rate as the younger patients. It is imperative that opioids are started at a lower dose, about 25 to 50% of the dose given to younger patients. This is according to a study done by the School of Medicine at the University of Nevada. Seniors with chronic conditions are not educated properly when being prescribed opioids for long-term care pain control. Often they are given printouts of the effects that they will never read, and they'll be sent home to try to navigate their own care. Intermountain Healthcare in Utah has been leading in their practices of properly informing their patients, and they quote, "Engaging in conversations about opioids with our patients has been an important element of our opioid misuse reduction efforts. We hear a broad array of responses from our patients during these conversations. While many patients express awareness about the potential dangers of opioids, other patients benefit from the additional education and the appropriate opioid disposal. This brings me to appropriate physician follow-up. It is imperative for seniors with acute to chronic pain that are prescribed narcotics to visit their physicians frequently. This could prevent hospitalizations due to misuse of narcotics, as well as noting the effects that can be so damaging to seniors, such as constipation, urinary retention, mild cognitive impairment. These could all be brought on by dosage errors. As you can see, the effects are devastating, but let's discuss some solutions. Congress must pass a law that heavily fines physicians for carelessly prescribing medications to seniors without properly educating them or considering alternative options for pain management. Making sure physicians are not only better educated on geriatric care, but also ensuring that opioid prescription is the best course of treatment for the patient, requiring a second physician sign-off as a safeguard for their patient and the physician. Requiring proper education is also vital to preventing misuse of opioids. Since seniors are the population with the largest amount of adverse effects. When prescribed opioids for long-term use, patients must attend a course on the effects and the proper use of narcotics. Today, we have learned why it is imperative that Congress take action to address the opioid crisis among senior citizens. We talked about the problem, the improper assessments, the little physician geriatric training, the lack of education, and inappropriate physician follow-up. But we can help the nearly 1 million senior adults living with substance use disorder. Remember, this could be your family, your parents, your grandparents, and it can be prevented. I hope today you have learned why senior opioid abuse is a crisis worth fighting. Help seniors like Dorothy live their golden years comfortably without the risk of falling into addiction. Thank you.